Welcome back to Modern Metabolic Health Podcast. Today I have a very special guest, Alyssa Simpson. She is a registered dietitian who is based in Phoenix, Arizona. She is the founder of Nutrition Resolution, which is a group practice of GI specialized dietitians that helps patients struggling with complex digestive issues get real lasting relief while still enjoying food. She also educates and supports the public through her podcast, The Gut Health Dialogue. So, welcome, Melissa. Thank you so much for being here today.
Thank you for having me. I had you on the Gut Health Dialogues like about a year ago, was it? And you did such a great job. I actually seeked you out because I wanted someone expert in GLP-1 to talk to my audience about it. And you did such a great job presenting the episode. I even sent it to my brother who's on a GLP-1, and it made him feel better about what he was doing and answered some of his questions. So I just appreciated that so much. And now it's great to be on your show.
Yeah, full circle moment. So, that's amazing. And I'm glad to hear that your brother is feeling better about
He's
his
lost
treatment.
60 pounds.
That is so wonderful. That is great. Thank
Yeah,
you for sharing that with
yeah.
me. And in my work as an obesity medicine physician, I spend a lot of time, talking to my patients and educating the public that weight management is so much more than calories in versus calories out. I talk a lot about the hormone side of things, but I'd love to hear from your perspective as a, registered dietitian focusing on GI health, how the microbiome plays a role in weight management.
Yeah, when we talk about calories in versus calories out, there's definitely truth to that. It's just an incomplete picture. And that's because that concept assumes that every calorie acts the same way in every body. And that's just not how our physiology works. So, from a gut health perspective, we want to ask, what is your body actually doing with the calories that you eat? And the microbiome is a big part of that. So, one thing we see is that there can be a difference in energy harvest. So certain gut bacteria balance, and we often see patterns where there's a higher ratio. So bacteria have certain phyla, meaning just groups, types of bacteria. So when we see a higher ratio of a phyla called Firmicutes to Bacteroidetes, we see our body is more efficient at breaking down components of food that otherwise wouldn't be fully absorbed. So like certain fibers and non-digestible carbohydrates. So over time, that can actually increase the amount of usable energy your body's pulling from the same diet. So two people can eat very similarly, but their bodies are not necessarily working with the same caloric input on the back end. One person is absorbing more calories from that food. And then another one, and this is one of the biggest pieces, is inflammation. So there's something called metabolic endotoxemia, and that's where certain gut bacteria, particularly gram-negative bacteria, which are the less favorable type that we want to keep in check in our microbiome, they produce an inflammatory compound called LPS. It stands for lipopolysaccharide. Um, and someone and if someone also has increased intestinal permeability, you might have heard of this. It's where they call it leaky gut. It's just where the cells lining the intestinal wall that separate the contents of the intestines from the bloodstream have little gaps between them. And so microscopic particles and toxins from inside the intestines get into the bloodstream, and this causes inflammation. And so LPS, that's produced by these gram-negative bacteria, is just part of their cell wall, and it can get into the bloodstream, and it triggers this low-grade inflammatory response. And that matters because that inflammation interferes with things like insulin signaling, and insulin signaling affects how the body uses and stores energy effectively. So if someone is technically in a calorie deficit, they have this inflammation happening, their body may not respond the way we expect because the underlying insulin signaling is being disrupted. And then the other thing that the microbiome affects is appetite regulation. And that's something a lot of people don't necessarily connect back to the gut, but the microbiome actually influences the production of hormones like GLP-1, which helps you feel full and satisfied after eating. So when the microbiome is in a healthier, more balanced state, those signals tend to be stronger and more consistent. And when it's not, you can be out of sync with your hunger, your cravings, and how satisfied you feel after meals.
Yeah, that's so fascinating. And thank you for going over that. And I think that just highlights how it's so much more complicated than what I think the general public believes or has been told previously. And now there's so much more out there, like acknowledgement about the role of gut health in our overall health and well-being. And I think we're learning more and more all the time about that and kind of filling those knowledge gaps. But there's still a lot to learn and apply to everyday life. But it makes me think also when some people who may not struggle as much with their weight and they are doing well with the typical diet and lifestyle recommendations and they don't struggle versus other people who are doing all of those quote unquote right things and they're struggling. Something like their gut microbiome or gut health could be one of those things that's playing a role in having that impact. So I think that's just important to acknowledge. And in your practice, is this something that you can tell is going on based on somebody's symptoms, or are you testing, doing any stool testing or blood testing, or how do you diagnose some of these conditions?
Yeah, I mean, we do testing. We can also look at the clinical picture. So if somebody's having a lot of, say, bloating, then we know that there's extra, let's say they're having bloating just eating normally, then we know there's extra fermentation happening that shouldn't be there. And so that's usually an imbalance of the microbiome, typically an overgrowth of less favorable bacteria, but we can also see low microbial diversity. And this happens a lot in people who have dieted for a long time. So especially if somebody's really restricted their food intake. We see it a lot in the gut health world because people will notice that certain foods give them symptoms. And very often in gut health, it's plant foods or fibers, which are in a ton of different foods, even in small amounts. So, like onion and garlic are big triggers, but they're in almost every cuisine on earth.
Mhm.
And so, even if you don't think you're eating a lot of plant foods, they're showing up in your diet and they're the healthy foods, right? So, people who are trying to diet and lose weight, they're going to eat more plant food. So, but anyway, people with gut health issues, if they're getting the bloating, if they're getting loose stools or abdominal discomfort or pain, they typically will restrict those foods, or maybe they'll even follow a structured diet protocol, like the low FODMAP diet is a really popular evidence-based one for IBS. But what that does over time and what just dietary restriction in general does over time is it lowers your microbial diversity, because what feeds a diverse microbiome is a diversity of different plant foods. So what happens is the your instead of your microbiome being able to handle um, you know, having a stable response, your system actually becomes more reactive over time and more prone to inflammation and blood sugar stability. So low diversity actually disrupts the metabolic environment because, if you think of your microbiome as kind of a team of workers, and each worker has a different job. Some are more, like helping with fermentation, breaking food down, producing short chain fatty acids, metabolic signaling, and then you just have fewer workers. You're going to be overloaded and not able to do the job. Work's going to build up. You're going to have lots of issues from that. So that's kind of what happens with this low diversity. So your question was, what do we look for? So we can kind of look at the clinical picture, we look at the symptoms, we look at the history. Has this person restricted a lot? And how's that showing up? And then we do testing. We absolutely do comprehensive digestive stool analysis testing, which is a poop test. And that will tell us, it'll map out the microbiome. It tells us about the all it maps out pages and pages of microbes. So it kind of reads like it's in Greek, but you have your different names of all your different microbes, and then it'll tell us the balance of the phyla. So earlier I mentioned the Firmicutes to the Bacteroidetes ratio. So it'll calculate things like the ratio. It'll calculate the diversity score. We're talking about diversity. It'll kind of tell us, is it in the red? Is it really low? Is it moderate in the yellow, or is it in the green? So those are so we and then the stool testing I like to use also gives us, indications of digestive sufficiency and inflammation and some other great information as well.
Yeah, it sounds like it gives you a lot of information that you also then compare with the clinical picture. And I'm sure with, the same thing in my field is that it's something that I'm sure you would agree that you recommend if somebody is getting that testing done to not just get it alone and to work with somebody who specializes in this area to interpret it correctly because I don't know if it's the same thing as what I hear with some like direct to consumer allergy testing. It can be interpreted incorrectly and could then lead to over restriction of certain foods or changes in dietary pattern that you don't necessarily need because it can be tricky to interpret. So I'm curious if you've seen people try to get those sorts of tests on their own and then apply it to their life and maybe didn't make that much of a difference or they're kind of frustrated with that versus if you are working directly with someone in more of a long-term capacity.
Oh, we absolutely see that. I mean, like I said, it's like it's in Greek. Now, the labs are trying to do a better job of, their printouts having more consumer friendly like presentation. However, these what we're talking about, these are really complex. So you really want someone who can bring insights to it. I mean, even newer clinicians, even newer dietitians and doctors who aren't familiar with these tests, still it takes them reading dozens and dozens and dozens of them, and maybe even hundreds before they really start to see certain patterns show up. I mean, we can see a marker come up that I've never seen come up before because I've only seen this a few dozen times. So that's type of thing can always happen. So you really want a clinician that's experienced, that's seen lots of different situations, that can interpret this based on your clinical picture, because we never want to treat a lab test, right? We want to treat a person, and we need to zoom out and look at the big picture and not try to yeah, these direct to consumer labs, I think they're just trying to sell more of their tests because I don't think it's necessarily responsible to expect people to doctor themselves. And I do understand why people do that because it can be hard to find the right help with some of these situations. And I empathize with that, but I don't know. There's definitely a downside.
Yeah, yeah, absolutely. Um, and speaking of, the gut microbiome and medications like GLP-1s that have become more and more popular, what has been your clinical experience in people who are using these medications, and has that been impacting their gut health? And how can, working with a dietitian who maybe specializes in gut health, impact how they are doing on a GLP-1 medication?
Yeah, so I really see, I see it as working hand in hand. So we really want to think of gut health as the foundation that GLP-1 medications are working on top of, because GLP-1 medications are incredibly effective at helping regulate appetite and blood sugar by amplifying that fullness signal and slowing gastric emptying in a controlled way, but the gut still needs to be functioning well. So we see a few, areas that really where gut health really helps. And the first is motility and digestion, because GLP-1 medications naturally slow gastric emptying, which is a big part of why people feel full. But if someone already has sluggish or uncoordinated motility, maybe they already kind of run constipated, or maybe they kind of swing between constipation and diarrhea. It's surprising how many people out there are walking around chronically constipated, and it's not really, they don't really, doesn't bother them, or maybe they don't realize that it's not normal or not optimal. And that's something that can be amplified when you start a medication like a GLP-1. So maybe it was something you were dealing with or you'd gotten used to before, and now things are really slowing down. So food is sitting heavier, bloating is starting to happen or getting worse, you're getting more constipated. So we still need to have, smooth, coordinated movement through the gut. Not just, the goal is not just to slow things down further and further. And then the second thing is when people eat less, it can affect the microbiome. So very common with GLP-1s, people eat less, meaning they also eat less variety and less fiber. And over time, that can impact the microbiome. So again, a wider variety of plant foods feeds a wider diversity of microbes. So if you're eating fewer plant foods, we get lower diversity over time. Kind of like how I was saying when people restrict foods because they cause pain or symptoms or just to lose weight. We also see reduced short chain fatty acid production, and those are metabolites that come out of the process of gut bacteria, good gut bacteria, eating plant foods, and then they produce these short chain fatty acids, which can help us have better metabolic signaling, help us feel more satisfied, and then just more sensitivity to foods, especially fiber. So that's where GLP-1s can kind of amplify what's already happening. So part of gut health work here is helping people to maintain or rebuild a resilient microbiome even when they have a reduced appetite.
Mhm.
And then also it can, a lot of the side effects people experience like nausea, constipation, food aversions, they can overlap with things we already see in people with underlying gut dysfunction. So it's not necessarily that the GLP-1 created those issues from scratch, but just amplified what was already there. And so we want to look at, supporting the gut, whether that's motility, digestion, or just the overall microbial environment, maintaining a diversity of plant foods, even in smaller amounts, doing what we need to do to support motility, whether that's bumping up the hydration, electrolytes, even just adding in additional supports as needed, because we really need to keep that motility going. And then if we do that, we're going to tolerate the medicine better. We're going to have fewer side effects and just be able to stay more consistent with it.
Mhm. Yeah, that was wonderful. I have a few thoughts off of that, and one
Mhm.
of the things overall that I was just thinking while you were talking was just again kind of how complex it can be and how much the treatment needs to be individualized based off of that person, where they were starting, before they were on a GLP-1 versus how they're responding to the medication and what their long-term goals are. So this is a common theme in my podcast is that it's important to work with somebody who is individualizing your plan and not just following a like their standard protocol. You deserve something that is individualized to you and how you're responding. And I think working with an obesity physician and a dietitian is such a big part of that and can really help improve your tolerance of the medication, your ability to stay on it long term, and to get the results that you're looking for. So I always recommend my patients to work with a dietitian if they have that option. And sometimes people are like, well, I already know I should eat more fruits and vegetables, or I should have this many calories, but I think it can be so much more than that. And I'm curious kind of what that process looks like when you are working with a client. How does that relationship build over time? And I guess, yeah, what does that process look like for when you're working
Well,
with?
it really is the personalization because I mean, what you just said, they're like, I already know what to do, right? But are you doing it? And do you know what to do when there's complexity
Mhm.
in there? Because we're in the information age. I mean, and now we have AI and people can, I mean, so dietitians may not be giving you new information, but a dietitian can bring to you strategies, tools, coaching, and she also has her own body of experience working with lots of different patients that have been dealing with very similar challenges that come up. So a lot of it's coaching, a lot of it's problem solving, a lot of it's helping you just to kind of navigate the things that always that what's it's like what's coming up if you know what to do, excuse me, what's coming up that keeps preventing you from doing it. There are probably some things, and we can help you sit down, think about or notice or track patterns, start to identify what's coming up, and then try some different ways of approaching things so you actually can incorporate some of these things. And it's going to look different for everybody. I mean, like, someone who doesn't like any vegetables, they're not going to sit there and make a veggie mash with 10 to 15 different vegetables in their blender. Or maybe they will, but they'll put the ice cube in their smoothie. So we do something in gut health called a veggie mash and because we're talking here about diversity. So you basically train your microbiome, and this might work really well for your patients as well, because you're not able to eat a large volume. And when we're working with clients, it's because they have that low diversity, or maybe microbial overgrowth. So they just can't tolerate a lot, but we want that diversity. So you throw 10 to 15 different vegetables in a food processor, you mix them together, you put them in an ice cube tray and freeze them, and then you just pop out a cube's worth. And while it's not very much volume, you get that diversity of different fibers to help work toward that goal of diverse microbiome. So anyway, that might be a strategy that you can start with, but maybe for somebody else, that's way too much work. They're not going to do it, but maybe they can pick up, a cereal blend with 7 different grains at their grocery store and have that instead of oatmeal for breakfast. So it's just things, we can't replace experience and clinical expertise. And I also brought up the complexity, on paper, you may be able to, you might need to eat a certain number of calories, you might need to increase your vegetable intake, just to stick with those two examples. But if you're harvesting more energy because your microbiome is out of balance, then that's not going to work for you. So then we need to maybe do some further testing, figure out what's overgrown, rebalance the microbiome, and then the standard advice will work better for you. So that's what we see a lot. When I first became a dietitian, I thought I would just be like educating people, regurgitating what I learned, but people have the information. They just need to know, well, what do I do in my situation? I have this going on, I have that going on. So I can't do this piece and I can't do that piece. And that's really where working with someone for that with that personalized, specialized care can be so helpful.
Hmm. That's amazing. I think those are great examples of how working with somebody who specializes and does this day in and day out can bring so much value to you that, yeah, I don't think that AI would necessarily come up with that veggie mash that you came up with. I have never heard of that, so I think that that's wonderful, because that is a very common issue with my patients is how can I, in a smaller volume and an overall lower calorie plan, get all of the nutrients that I need. Um, Another thing I thought of when you're talking earlier is patients who are on GLP-1 medications, there's so much emphasis on protein and getting enough protein in their diet that fiber often gets overlooked or forgotten. So that's something that I'm reminding patients that we need to focus on. Do you have some tips on how to get started in incorporating more fiber in anyone in general, and then for people who are on GLP-1 medications?
Yeah, I definitely think it does depend on the gut environment. Fiber can be a tricky one. So if the person is also experiencing constipation, it depends. You might need to ease into fiber. We think and the general advice is eat more fiber. It will help with constipation. But there are some situations where it can actually make it worse. Maybe you're not hydrated enough, or maybe the bacteria that are in your gut or the balance of microbes in your gut are actually going to produce. we see something called a methane overgrowth pattern where certain microbes will actually produce methane gas when they eat fiber, which will um, slow motility further. So I'm saying all this to say we always want to ease in when we're talking about amount of fiber. And I'm thinking specifically with like a fiber supplement. So if we're taking a fiber supplement, you might start with a third of the scoop and do that for a week. If that's too much, start with a quarter teaspoon and do that for a week. I mean, with fiber, you want to start with the most ridiculously small amount you can tolerate. If, and I'm saying if it's something that's challenging, which is why we're talking about it, right? Start with if you just find the ridiculous portion you can tolerate and let your body get used to that, and then make an increase every few days or every week or something like that. So, in the example of a quarter teaspoon, then the second week you're up to a half teaspoon. And time passes. So, if you keep going like this, you will build that resilience of your microbiome in a way that you can tolerate. And then the other thing is we talk about this with just sensitive guts, or it's great for your audience too, is just more diversity. So the veggie mash, I think, gives everyone a great visual of what we're talking about. It can be a teeny tiny amount. I mean, gut bacteria, they're incredibly small. They don't need very much, but they need a variety if we want a variety of them, because different bacteria like different types of fibers and different types of foods. So, it could be the veggie mash. I love the idea of like there are so many, if you go to Sprouts or Whole Foods, there are so many different fun, cool grain blends that might have half a dozen grains and seeds and in them. So it could be like a hot cereal, it could be a cold cereal. I mean, they could even have a dozen plant foods in there. Because remember, a plant food, when we're talking about fiber, we've been talking a lot about vegetables, but plant foods are vegetables, fruits, nuts, seeds, legumes, and whole grains. So we have 7 categories. So it could be more like a grain and seed blend. They have little, snack bars that might have half a dozen or a dozen grains and seeds in them. So that's another area that you can tap into. I was at Sprouts the other day and they have these frozen veggie burgers that have like legumes and different veggies in them. And I counted about 10 different plant foods in there, and just have a small portion. If you can't eat the whole thing, eat a portion of it, but think about diversity. If you're walking around the produce section, instead of buying a bag of romaine lettuce, buy a bag of the mixed greens that has 5 or 6 greens in there. So when you start thinking in terms of diversity, you'll see more and more opportunities to get it, even in small amounts.
Yeah, that's great advice. And it's something that you can build on over time, kind of like you're mentioning. You can find one thing at the store that you want to try, and if you like it, you can keep doing that, and then you can look for the next thing that you want to try and add into your diet. I think that's wonderful. Um, I know this could get us on a whole different topic, but I just wanted to at least briefly get your opinion on probiotics, because I think also when you're talking about like the direct to consumer testing, then there's a lot of marketing out there for selling those tests. I feel like similar thing with probiotics, and I'm sure like I said, we can get into the weeds, but I would just love to hear your thoughts if someone is thinking about starting a probiotic. Is that a good idea? Should they talk with a dietitian or a doctor first? What are your, I guess, overall thoughts about that?
It can be helpful, but I think we want to understand what they're actually doing and what situations they're helpful in. So we do know that certain strains have certain health benefits, and those are benefits that we might need to incur. So some are more helpful for, certain symptoms, some are more helpful maybe for certain metabolic outcomes. And so it makes sense to take that strain. I think one of the biggest misconceptions is that if we take probiotics, we're going to seed the microbiome. So we're going to fill up our gut with all the good bacteria that we need. But probiotics, they're not, and so maybe we can take the probiotics for a while and then we'll be planted, our garden will be lush and vibrant. But probiotics, they're only active as long as they're transient. So if we take a probiotic, it'll be active as long as it's in our gut, but it's going to get flushed out after a certain period of time. It's not like it's going to stay there and seed and thrive forever. So probiotics are beneficial as long as you're taking them. The other thing to keep in mind is that uh, they take some time to work. So I see this so often, not just with probiotics, but any supplement that people are taking for a specific purpose like this, is they might take it for a few days, they don't quote notice anything and they stop. So probiotics can take actually months to start seeing those effects, weeks to months, I would say, just depending on the study, depending on the strain. So it's a long game. So just keeping that in mind. It's not something where I very rarely have somebody just hear about somebody taking a probiotic and suddenly their bloating is gone, or suddenly they're not having diarrhea anymore. It's an effect that builds over time gradually. I honestly like if we wanted to talk about the best thing, it would be prebiotics, because prebiotics are actually AKA for a lot of kind of the fibers we're talking about today, because prebiotics are the food for bacteria. So if I were in a world where I had to choose probiotics or prebiotics, I would say prebiotics are more important. It's just that because of a lot of the issues we've been talking about today, if the microbiome is not ready for it, just like fiber, sometimes it can backfire and cause things like bloating or loose stools or discomfort. So I do think for your population, people who are on GLP-1s, maybe having some digestive side effects or challenges with that, and also not having challenges eating a diversity of different plant foods, a probiotic might be helpful. But you would want to pick a strain that has researched benefits in what's important to you. And you'd probably need to stick with it, but I would not ignore the other things we're talking about to help support the healthy microbiome.
Thank you. And we've covered so much great information today. If anyone is looking to, learn more about you and learn from you or work with you, where should they go?
So we're at nutritionresolution.com. Um, our team helps people with, stubborn chronic digestive issues. A lot of our patients have they've been to the GI doctor, they've had all the scopes. Sometimes they find something wrong and maybe the treatment is a medication, but it's, not helping that much. Or sometimes they can't find anything wrong. So it falls under that IBS or functional dyspepsia sort of umbrella. So we help people, to address their microbiome, support digestion. We help with diet and lifestyle interventions and targeted supplements to actually restore digestive wellness so that and the key, like the biggest emphasis in our practice, is without having to be super restrictive with your diet, because if you whittle your diet down to chicken and rice, you may be able to control your digestive symptoms, but that's not going to work long term. So we help people rebalance their gut to get back to resilient microbiome, resilient digestive health, calm their symptoms without dietary restriction being the end all be all. And we're at nutritionresolution.com. We have a ton of blog articles, free diet guides that are based on your problem. So if you go to our diet guide tab, you'll see just all kinds of different free materials. And then if you feel like you'd like that, personalized support, we have a team of dietitians, so you can just schedule a strategy call and we'll go from there.
I love it. And I will definitely link that below for anyone interested. Thank you so much, Alyssa. I really appreciate you taking the time and sharing your knowledge and experience with my audience.
You're very welcome.